my name is Jonathan Cervantes, and my speech is on chronic traumatic encephalopathy. Chronic traumatic encephalopathy, or CTE, is a relatively new diagnosis, first diagnosed and documented in 2002 in a football player. This diagnosis is only given after studying the brain of the deceased individual through an autopsy. Basically, CTE is a slow degeneration of the brain caused by repeated injury and trauma to the head. This is seen mostly in contact sports such as football and boxing. CTE is not well understood by researchers yet because it can only be studied in the deceased. They cannot say for certain exactly what causes it, and it is also hard to know the exact symptoms and prognosis. With time, research is improving, and in very rare cases, it can be diagnosed in a living person with high-risk exposures. Usually, symptoms of CTE do not appear right away. Symptoms usually develop years and even decades later after the repeated head trauma occurred. In a few people that have been diagnosed with CTE, the symptoms include cognitive impairment, behavioral changes, mood disorders, and motor systems. Some examples of cognitive impairment are difficulty thinking, loss of memory, problems with planning and organizing, and difficulty carrying out tasks. Some behavioral changes are impulsive behavior and anger and aggression. Some mood disorders are depression, unstable moods, substance abuse or addiction, and suicidal thoughts. Some motor symptoms are Parkinsonism, motor neuron disease. Some causes are likely repetitive head trauma and contact sports and physical abuse. Not all people that experience repeated head concussions go on to develop CTE. In brains with diagnosed CTE, a buildup of protein has been found around the blood vessels by researchers, and areas of the brain waste away. May show signs of another neurodegenerative disease such as Alzheimer's or Parkinson's. Currently, there is no treatment for CTE. When CTE is suspected, the current treatment protocol is to protect the patient from further head injuries. Boston University identified 4 stages of CTE in a 2012 study. This is a healthy brain right here. Stage 1 symptoms include headaches and problems with concentration and focus. Stage 2 includes symptoms of the first stage as well as depression, unstable moods, and short-term memory loss. Stage 3 symptoms include problems with planning and organizing and other cognitive difficulties. And stage 4, memory problems become more severe. Often dementia follows. Cognitive and mood issues also become more severe, and aggression may worsen. Suicide behavior is also common in this stage. Take steps to reduce your risk of developing CTE by avoiding contact sports and any other situations that pose a risk of head injuries. If you do not play contact sports or participate in high-risk activities, always use protective headgear and always follow safety rules and guidelines. If you receive a head injury, follow the orders and advice of medical professionals. Take precautions to avoid future head injuries. As mentioned before, CTE is a relatively new diagnosis, and there is still lots of studying and research happening on it. Researchers and doctors do not know with certainty what the exact cause is, but they can conclude that repeated head trauma is a very high risk factor. Right now, there is no treatment, and the best thing we can do is protect ourselves from head injury by wearing the proper safety equipment and, if necessary, avoiding contact sports. The NFL is aware of the studies regarding CTE, which is why they have been getting stricter rules regarding concussion protocols and greater penalties for unnecessary hits. Overall, I have learned that even myself in high school football, I am at 20% risk of developing CTE. This could be a lifelong debilitating disease and something I am not willing to risk. I hope more research is continuing to be done so we can understand better and maybe learn how to stop or slow the progression of brain degeneration.